Labrīt. Man ir tas gods šodien būt šeit ar jums. Pirmkārt, Dr. Hossam, apsveicu un vēlam veiksmi. Un mums visiem šī ir mūsu kopīgā apņemšanās kopīgi pārvērt cilvēku pieredzi veselības aprūpē. Okay? That is all I will try to do. Now there is 2 million and one Latvian speakers? Yes. It's truly an honor to be with you today. Those of you that know me know I like to run around on stage. I'm going to try to stay put because we have so many people joining us online. So thank you for being with us and thank you for being in the room today. I'm going to speak today about this idea of to care as human. So first, context. I'm Džeisona Vulfa. I am the product actually of a physician. My grandfather was a pediatrician from the old Osler School, studied in McGill, and came from a centered, person-centered perspective. I grew up playing in the pediatric waiting room of his office. I don't think we let our kids play in the pediatric waiting rooms anymore, but I think it's why I have lots of good immunity. We as an institute represent tens of thousands of people with members in almost 100 countries around the world. So today my job is to speak to you in the context of a global lens, to set the context for the day. And I know you're going to hear some amazing speakers that get to the practical aspects and practices to drive this work. But I want to set the stage, set the context in, I think, a beautiful way that the minister kind of said. This is an important thing for the citizens, not just of Latvia, but of the world. And you are doing things here that will inspire others as well. I'm also going to ask you a question that I hope we will think about. What is that one thing or two things that you will do as a result of being here in this room or online with us today? This isn't simply just to listen, but to think about what comes next, what actions you will take, and I hope you will do that as well. And if you'll indulge me, I like to tell stories. So this is my son, Sam. He's a little younger in this picture. He's a footballer, and we'll talk a bit about that. And one day we were at practice for his soccer in the United States Football Club, and we were in a gymnasium in a locker room, and he looks across the locker room and he sees this young man wearing the symbol of our local soccer club. He got so excited, and he's like, "Dad, I have to go say hi." And my little 5-year-old runs across this locker room. Probably not a good thing to just let your child run across locker rooms when he's 5, but yet, here he goes. And he finds this young man, and he looks at him and says, "Excuse me, sir, are you a professional soccer player?" And I watched this young man's face light up like the sun. And I see him bend down to Sam and say, "Why, yes, I am." And we got into this whole conversation around the fact that it was literally his 5th day of work as a professional soccer player. In fact, my son was the first one that actually formally called him that. And what we found in that moment was the beauty of youth, but more so our willingness to communicate and connect human being to human being. We do that every day. Those of us that practice medicine, those of us that support the practice of medicine, those of us that are patients and families in the room and online. And I want to speak from that idea that when we find that capacity to care for and connect with one another, it's so critical. So I'll tell you more about that story later, because there's a quote I'd love to share from the poet Maya Angelou, and we're going to speak from this premise today. If you find it in your heart to care for somebody else, you will have succeeded. And this idea of care to me is really critical. That it's not just simply the idea of what care is, but it's what it means in action. When we speak about this, when we speak about care, while we are here in this room, when we talk about the humanity in healthcare, it is to feel interest or concern. We come together, we practice medicine, we support the practice of healthcare because we believe in something bigger than ourselves. And this is something that I think you are doing here in Latvia in a way that will be profoundly impactful to people around the world. You are setting the example at a national level of what it can mean to actually commit to transforming the human experience in healthcare. And I'm going to ask a tough question because it's early still in the morning. How many people here are human beings? This is tough, I would hope. Online you can raise your hand too, even if you're in your pajamas. The one question that no matter where I stand in any continent around the world, when I ask that question, everyone can raise their hand. How many people here are human beings? And the essence then of healthcare itself, what we will speak to today is this idea that we are ultimately human beings caring for human beings. And the capacity for us to do that is the foundation on which we build any real healthcare encounter, any real opportunity. You know, we have been through a lot. I think we know that the last few years in particular, as we've traversed the pandemic and now the endemic, has transformed the foundation on which healthcare was built. It's exposed cracks in our own work. It's understood that challenged our healthcare workforce, it's challenged our healthcare workforce and created incredible storms and churns. We know that we feel financial pressures. We heard about it this morning already. We understand the challenges of higher acuity patients. We're dealing with volume in healthcare like we've never seen before and trying to figure out where our patients and families can go for care. We have to operate in that context. That is the reality in which we operate today, but I believe these are things that we can overcome. And for that reason, I want to speak to a context of experience first. And so today I'll speak to the context of experience, why it matters, then how we can collectively transform the human experience. And then I also want to maybe challenge you as individuals to think about, what does this mean for me as an individual? I was told a story once. There was a phone call that came into the reception desk of a hospital, and the woman on the side of the phone said, hello, yes, I was trying to find out some information, let's say Ms. Steiner in room 301. We believe she's getting her test results back and should be discharged today. We're just trying to find out some more information. And the receptionist, being very service-oriented and customer service-oriented, said, yes, let me find out what I can, and honoring privacy and all of that, does some research, gets back on the phone with the person and says, ma'am, yes, in fact, what you said is correct. And then goes the extra step. I know it's sometimes hard to find our hospital or where to park or where to come to meet Ms. Steiner when it's time for her to be discharged. Can I provide you any of that information? And as the receptionist said, there was a big sigh on the phone. No, ma'am, this is actually Ms. Steiner in room 301, and nobody tells me a dang thing around here. The reality is that when our patients are calling the reception desk to find out their course of care, we have missed that opportunity of connection. We have missed that opportunity of Sam walking across the room to meet that young professional footballer and have that moment of connection. And when our patients and families are asking for that kind of help, we have huge opportunities. You see, people have asked me around the world, what is the secret to making experience work? And I would say it's really one word: choice. It's the choice that we make, one human being to another, in terms of how we want to interact with one another. So I always say, how many people here made a choice today? Another tough question. This is the other question I can usually ask, and I see all hands. So let's test it. How many people chose, I'm going to the conference today, I'm going to brush my teeth, right? So this is when people tend to change seats or something like that. But we make choices all the time, and this idea of choice is fundamental. You see, we are not in this conversation speaking about satisfaction. See, satisfaction is based in moments, about how someone's expectations are met or not met. When we speak to this idea of experience, what we are talking about is something much more profound. We're speaking to the idea of something we live through. It's our lasting story. We all have that healthcare story right now. It's all that's perceived, understood, and remembered. Whether we are a doctor at a bedside that remembers that patients for our lives because we transformed their lives or we lost them. Whether we are a patient and family member that held the hand of a loved one who was treated amazingly or horribly. These are the stories that emanate through our healthcare systems around the world. That's what we speak of when we speak of experience. And I want to be clear that we have to look at this from an integrated perspective. You see, we have mastered the art in healthcare of managing the chaos, right? Of dealing with quality issues in one place or safety issues in another, of how we ensure good outcomes or deal with cost, how we provide the best in service, and then integrating patient and family engagement with the way we engage our workforce. Yet when we look at it from the outside in, from the citizen, from the consumer, from the patient and family perspective, these are all but part of their experience. And this is the lens that I will speak to today. That when you talk to patients and families, and when we survey patients and families, they say, I expect quality and safe experiences. But my experience is much more than that. It's how you treat me as a human being, and it brings in issues of community engagement, equity, and access to the healthcare system as well. In fact, I'll share some research and data along the way. We found this in our most recent State of Human Experience study, that people see healthcare as an integration of all of these things: quality, safety, service, access to care, workforce engagement, equity, community engagement, cost. All of this factors into the way that people citizens see experience overall. And when we think from that integrated lens, when we address this topic from that lens, it calls on us to think a little bit differently. And the way that we define experience in our community and really in our communities around the world is on 4 core concepts. Around interactions that we have, human being to human being. Around the cultures that we build in our healthcare institutions to provide the best in encounters, human being to human being. Around the fact that experience is the perception of patients and families, and whether we believe that is the right thing or not, it is what it is. What patients and families perceive in terms of their care is the fact, no matter what the data tells us. And I think we have to understand that as well. It is the story that people tell, and it happens at all touch points across the continuum of care. This is not simply a clinical box that we're speaking to anymore. The experience that people have with each of your hospitals, clinics, practices, happen well before they ever enter the door. And the stories they tell linger well after, and that is the opportunity that we're speaking here. How we change that narrative in a way that experience truly is the sum of all those interactions shaped by the cultures that you build in your organizations that influence the perceptions of patients, families, their care partners across the continuum of care. And that to me is why experience matters. I'd love to share a story if I could. I was recently, we have an incredible postgraduate program in Sao Paulo, Brazil, and this was on a rounds that I did at an oncology unit and the palliative care unit. And I was speaking to this nurse director that I'm standing next to, and she told me the story of a mother who was literally in her last days of life. And they asked her if she wanted pain medication or what she would want to kind of make it through. And you know what her request was? Because they asked what mattered to her, I would like to have my daughter's 5th birthday with her. And they did everything through the magic of medicine, science, art, and heart to ensure that they could keep that woman alive so that the daughter on her 5th birthday could be there to hold her mom's hand. And they did that because they asked what mattered to the patient, not just provided what the health science told them they should. Now, unfortunately, that mother was lost a few days later, and as I was told, just off camera here in the picture was this young girl's father, who said to me, it was just about a week or 2 later, she's pulling on my shirt and says, "Daddy, I want to go there. I want to go there." And he's like, "Where do you want to go?" And she said, "I want to go back to the hospital." And he's like, "Well, why would you want to do that? We lost Mom there. We're sad. We're grieving." She said, "No, please, Daddy, please." And so he says, "Okay, let's go." The little girl packs up her bag, stuffs some paper in there, and they go back, and she wants to go to this unit to find this nurse that I'm standing next to. And she unpacks her bag, and she hands all these notes to her for all the nurses in that unit to say, "Thank you for my birthday party with my mom." And then she did one of these little kid things like our kids do to us sometimes. She kind of waved her over and said, "And I want to tell you what I want to be when I grow up. I want to be a nurse." See, we impact lives in ways that we might never know. What had us choose healthcare as a path? Think about that for yourself. These are the things that we deal with, and these are the interactions that matter. So I'm going to leave you with a couple thoughts and a piece of data on what this ultimately means. First, and as we see in this story, we must honor people come to us at their most vulnerable moments. When we're thinking about human beings caring for human beings, these are the realities. People come to us at their most vulnerable moments, and we ask citizens, when we ask people around the world in our own consumer research what matters to them, they tell us, it's about my health first. Let's not be fooled. This is not how happy I am in healthcare. People see their experience as their health and well-being first. But then, right after that is how you treat me with dignity and respect as a human being. Are you listening to me and communicating to me in ways that I can understand? People want that as well. Yes, people can imagine and be thankful for being healed, but they can also be harmed in that same process. And so how we think about how we engage people as human beings is so important. You know, that idea of how we interact with people is so important. And so, as we heard in that story as well, there is not one interaction that we can ever take for granted. Asking what matters, what conversations we have, how we ensure that we're engaging people in moments that matter to them is fundamental in their work as well. And what we found in our data as well in talking to consumers around the world is when asking them to rank all of these things that are important to them, the things that they told us are most important, that most associate with experience is listen to me, communicate in a way that I can understand, and provide me a clear plan of care. So it is, first, treat me as a human being, and then provide me with clinical excellence overall. When we look at all the other things that were at the other end of the spectrum, right, quiet, peaceful environment, nice facilities, good food, all these kind of things, amenities. These were the lowest ranked things. Not that these aren't important, but when you look at this for a long time, people I think thought experience, when we spoke to it, were the things on the right side of the screen. They're not. What people want is to be treated as a human being, caring for a human being. And in fact, you know what? The things on the left are a lot less expensive than the things on the right as well. So experience doesn't cost us a lot if we commit to it as human beings as well. It's about bringing the vibrancy of our healthcare system to life. It's about bringing the system that we build our healthcare system on to life as well. And so with that, we can never care well for others without first caring for each other. We can't have a conversation about experience where patients and families are objects of some system. They're not. If we don't think about the workforce on which we build healthcare around caring for the people who show up to work every day, we miss a significant opportunity. And in our research and looking at institutions that perform well in experience, what we found is that they even acknowledge that it's how we treat people first that matters. But what they say very closely after that is how we operate as a care team ourselves. In fact, there's tons of research out there that will tell you when patients and families perceive teamwork among the care team, they actually have better experiences. And so as they look at how we work with one another, the cultures we build, it's matter. You see, the art of healthcare and the work of healthcare is a long, long race. You can almost hear the chariots of fire blaring in the background, right? But it is really the idea of the story, like what we do and don't do. That interaction of that nurse with that child and that mother is the story, as we talked about, others will tell. That is the opportunity that we have. And what we find, again, in speaking to consumers around the world, is that they have choices. And in fact, people tell other people about you, whether that's fair or not. The story of what your practice did or your hospital did or your clinic did is the story that other people tell. And as a result of an experience, positive or negative, people are telling others first. They're deciding not to come back to you. And in fact, people are telling us, we just have research we haven't even published yet that I heard about this week, that are showing people want relationships with their providers, most importantly. And when that relationship and that trust is broken, they will find another place to go. And so this idea of telling the story leads us to this whole conversation around transforming the human experience that we're going to speak to today. And I know we're going to hear from Vita in a second around how it can truly be impacted here in Latvia. But I think if we're going to frame the future of human experience, we need to think about transforming our health system just enough. We talk about the realities of the healthcare system being heavy. I think the minister eloquently said it. Yeah, it is not something we can change in 24 hours or a week or even a month. And it takes time, effort, and it takes all of us together to do it. But I do think some transformational change is necessary. And it is first a change in perspective. We have to move from this idea of everybody in their own bucket and own silo to a more integrated and systemic lens. How do we begin to create collaborative conversations and bring voices together like we heard today from non-government associations, government, our healthcare, private practices? All of these things need to begin to work together and inside our systems as well. We can't be competing for this dollar in this segment of our hospital and that dollar in that segment of our hospital and actually provide a consistent experience. Remember, when patients and families look at us, they don't know if this department or that department had more money or not. Their experience is the totality of all those encounters they have with you. We also have to think about changes in process. We have built a healthcare system, as we talked about, that has been very transactional, and it's in order to survive somewhat the chaos. We have an opportunity, and it's what people are asking for from us, to build a relational healthcare system. They want to have a relation with us and engage with us as human beings in the work that they do. And I think we have to change our focus. We've lived in a very aspirational perspective in healthcare. And what's exciting to me about this very conference is we are moving from talking about wouldn't it be nice to what can we do? And that's really the challenge, why I asked you from the beginning, what is that one thing that you will do as a result of the conversations we have here? What is that takeaway or action as you listen through the course of the day that might transform your practice, might have you speak differently or engage differently as a patient or family? Think about the way we structure or measure the work that we do. You see, because when we speak from a human experience lens, we have to think more broadly than just the idea, as we said, of patient satisfaction. When we speak to this idea of human experience and the digging into the research and the literature, what we really believe it is this idea, that at the heart of all we do is still the patient experience, that sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. But if we don't integrate the workforce experience and we don't think about the community or the citizenship experience in our healthcare system, then we've lost the opportunity to truly improve and transform the human experience. How we think about access and equity is as important as how we think about the service or quality encounter inside a healthcare system. How we ensure our workforce feels cared for and has a sense of well-being in the world right now where we are feeling such breakdown in our own resilience and burnout in our own healthcare systems. How do we care for one another that show up to work every day in healthcare? If we don't think in a systemic way, then we are never going to ultimately transform the experience of patients and families. This is not about the measure. And if we think about it that way, we miss a huge opportunity. You see, the human experience, we believe, is not leaving patient experience behind, but it is truly extending that conversation. And what we see again and again around the world is a conversation around if we don't care for each other, we can't care for others. If we don't care for our communities, we can't provide the best in experience. And the stories that are told weave all of those things together. And that's our opportunity. You see, we find again and again as well in our research that when we focus on experience, we drive all the outcomes that matter. Customer service and reputation, loyalty and clinical outcomes, the trust from our community, employee engagement and retention, and the workforce trust in us as well. Community health, well-being, all the things we aspire to collectively from a health system can come from a strategic focus of what it means to ultimately care for the human experience in our midst. And we can still work on all the segments that are important, right? Managing outcomes and costs around quality and safety and all of these integrated pieces that matter. But if we don't connect all of that for our citizens, then we've missed the opportunity that people are looking for from our healthcare systems around the world. And that's what we consistently see again and again. And we've had an opportunity to speak to some of our members and talk to our global members around the world around what really matters in driving this. So some structural things that I want to share with you, and then we're going to speak about value and what you can do about it. You know, what connects us is strong, and I think what we find is there's a couple things that we can be doing in our own organizations individually to drive experience outcomes. So we have to have clear strategy around what we mean for experience. We have to communicate relentlessly in what it means, not just to our staff and our teams, but to our communities and our patients and families. We have to care for those who offer or support care, like I said, our workforce, and we have to engage leaders at all levels. I love to go into healthcare systems and ask how many people here are leaders. And when just the people that officially are leaders by title raise their hand, there is a problem. Because I have yet to find a nurse at the bedside who goes to ask for permission for what she's going to do next. Every person providing care, showing up, mopping floors, bringing trays, are leaders in a healthcare organization. They are managing the interaction with the human being in front of them. They are perpetuating and building the story people tell. They are the experience you provide. We have to invest in more formal learning. So how do we help people understand what this means and what roles and opportunities they have? And we have to elevate a commitment to partnership with our patients and families, building on co-design and co-production, and understanding that the voices of those that experience our healthcare system are experts in the lived experience and actually can help us transform healthcare overall. We have to measure in a way that we can share openly, not some surveys that people wonder whatever happens to what we ask them, but that we measure, ask questions, and then move that conversation forward in a way that matters. And we have to champion equity in doing so. And I think we have to understand that experience is a journey. This is not an initiative that you have a beginning, middle, and end. This never stops. We are going to continuously and relentlessly move this forward. And like I like to say, while our commitment is global, our actions must be local. And that's the important thing about this conversation today. You see, we see incredible value as we look at experience, and we're working on a paper right now on this, that we are seeing the idea of patient-family care partner value, and I know we're going to hear from Vita here in a moment on digging even deeper into value. We see the reality of workforce and team value, as we've spoken to. We see that opportunity for community and consumer value, and we see ultimately also organizational and business value that leads to everything we aspire to. Reduce cost of care, improve quality, engage workforce, how we become providers of choice. We create community well-being. We improve growth, even market share for those that look for that. And it starts with you. And so I want to leave you with some thoughts around what does this mean for me as a practitioner of care, as a patient or family member? And I'm just going to tell you maybe a couple quick brief stories. We first have to be willing to listen for more than what is said. I was at a conference a few years ago. My son was about to be born, and the phone rings, and my wife is 38 weeks pregnant, and I'm in another state. That's not a good idea as a husband, right? I speed home. We get there. The doctor says, come to the hospital. We pull into this hospital, and I'm like leaving the car with the lights blinking, and the person at the reception desk at the hospital looks at me. My wife is doing fine. She looks at me and says, are you okay? Are you okay? It must have looked horrible, right? And she puts her arm around me and starts singing, everything's going to be okay, my boy, everything's going to be okay. See, she saw something in me as a family member to care for me. She listened to more than what is said. We should be and could be doing that. We also have to be willing to own moments of change, the things that matter. There's a story I was told about a hospital that used to produce 2 cups of rice pudding, of this dessert that would sit in the kitchen every day. And it would just continually be there over and over again until someone finally asked, why is this here? And it turns out that it was about 5 CEOs of this hospital ago that liked rice pudding. And it was written into the protocols that they should always make the rice pudding in the kitchen. Nobody ever asked why or if they should continue to do so. Someone finally asked. And after 12 years of making rice puddings and throwing them out, they finally stopped. I will be willing to bet that somewhere in all of your practices, hospital systems, someone is making rice pudding today. So how do we ensure that we stop doing that as well? And then we always have to run over the top. In fact, it's a phrase that I wear on my watch when I was out for my run this morning as the sun was rising over Riga. I had a track coach who would literally take us out into a big hill where I grew up and drop us at the bottom and drive up to the top. And he would just yell, run! And we would run up the hill, and we'd get to the top and be all proud we got there. And he would send us back down. And we would run up the hill again, and he'd tell us to stop and go back down. And finally, we were like, no, we're not doing this anymore. So we figured if we just kept running, he wouldn't stop us. So we ran up the hill, we ran past, and we kept going, and we just heard this, stop! And we all turned around, and he said, that's exactly what I want you to do. Everyone else is going to stop when they think they reached the top. But if you're willing to run over the top, just that step more for that patient, that family member, that race, we have the opportunity to ultimately transform the healthcare system. And that is where I think we ultimately end with why we're here today. Gratitude for the opportunity that we have to be in healthcare, for the opportunity we have to care for others, for the services that we get as patients and families. And I think we have to wear gratitude like a cloak. You see, there was a young boy I told you about. So that's my Sam. Mr. Martin, the young professional footballer that he met, reached out to me and said, hey, I have some tickets. And so Sam and I get to go to this game with Mr. Martin. And he is not watching the game at all. He's looking around like, when is he going to see Mr. Martin? Now, Mr. Martin, actually, Joe, is from Portugal, believe it or not. He's from Lisbon, too. And finally, at the end of the game, I get a message. He's like, can you come up here? And I'm like, where? And we go up there, and there is Mr. Martin with my boy. And I can't tell who was more happy to see who in this picture, because here's the young boy that told me I was a professional footballer and the young boy that's meeting his dream professional footballer. And it wasn't so much that, but look at that face. Don't you wish every patient and family member that you cared for looked at you that way? But what's also there is what's in his hands. All the thank you notes that Sam wrote to him for being there for him, for the opportunity that he provided him. And those still hang on his wall. He's playing now in Western Australia, of all places. And he still has those pictures, he told me today. We talked last week. And this is Sam now grown up. He's got a little bit bigger these days. He's a goalkeeper. It's a horrible parent's job, let me just tell you. But I'll leave you with this, because I know I'm probably over my time already. Experience is not something we do, but experience is who we are. It's the choices that you make each day. It's the opportunities that we have in front of us. It's why we're in this room today. I mean, I'm truly excited and humbled by what you are trying to do here, by the opportunities that lay ahead, by the choices that you will make, by the consideration that you have for that one patient or family member, for the citizens of Latvia, for the impact you will have on the world because of what you decide to do next. And so that's the opportunity that I believe. That's what brought me here today. That's the splash, the waves that I hope that you will make. That's the choices that I hope that you will take. And that's the realities of all the things that I shared with you today. Because at the end of the day, we are ultimately, right, human beings caring for human beings. And so I am so grateful and thankful to you all. I wish you the best of luck on this journey, and I'm so excited for the rest of the day. Thank you so much.